even a physiotherapy student, when you need information about joint mobilization, then this video is more helpful for you. In this particular video, I will be introducing you to joint mobilization, and I will try as much as possible to introduce you to some related terminologies associated with joint mobilization that you need to know to give you more insights about this particular topic. So let's do this together. Stay connected. I'll be back. Alright, welcome back. So now let me talk entirely about joint mobilization. I'll be introducing you to some terminologies one after the other, so don't be in a rush. I'll make sure I tackle every important thing that is about joint mobilization. So I'll first start with joint mobilization. When we say joint mobilization, what does it mean? Alright, so joint mobilization is a manual therapy which is characterized by movements of joints in their full range of motion in such speed and amplitude which is more stoppable by the patient. So joint mobilization is different from joint manipulation. The latter is a special technique that is performed by experts. There are people that are expertise in performing joint manipulation. Joint manipulation can also be termed as thrust. The technique is more characterized by movement of a joint in such speed and amplitude which is very fast and difficult to be stopped by the patient. The technique is more used in correcting joint malalignment, breaking adhesions, and correct joint dislocations or subluxations. But in the case of joint mobilization will become more necessary in instances where movement is threatened. So you can think of the case like joint effusion, you can think of joint pain or muscle guarding, joint hypermobility, capsular adhesions and contractures, and then you can also think of some joint malalignment that can be stabilization or dislocation. In these cases, we assume that movement is threatened, and so the joint is likely to be exposed to adhesions or to be reduced in their range of motion. So we request that joint mobilization needs to be incorporated in these cases. So if you are treating joint mobilization, or if you want information about joint mobilization, then you should have your mind on some of these terminologies. The first terminology is known as osteokinematics. Osteokinematics. What is osteokinematics? Alright, so an osteokinematics is an observable movement. So it is also known as physiological movement. This movement is often more observable to the patient, or when the movement is performed, it is more observable. So you can think of extension, flexion, abduction, circumduction, external rotation, internal rotation, and so on and so forth. These are osteokinematics. They are movements that are observable. Another terminology that you need to also note when you are treating joint mobilization is arthro-kinematics. Arthro-kinematics. What is arthro-kinematics? Arthro-kinematics is opposite osteokinematics. This is an accessory movement. It can also mean joint play. Joint play movements are accessory movements, and they are movements that are not observable. The movement occurs entirely in the joint capsule. So before a physiological movement, which is osteokinematics, can occur, there should be an intact accessory movement, which is arthro-kinematics. Arthro-kinematics can be gliding, rolling, distraction, sliding, traction. These are movements that are not observable, and they are termed accessory movement. Are you ready to get explanations to some of the examples I gave under arthro-kinematics? I mean rolling, gliding, and distraction. I'll talk about these three so that you get to know them whenever you are treating joint mobilization. So I'll first start with rolling. What is meant by rolling? Alright, so before I explain the term rolling, let's get this overview to boost our understanding. We know that joint is formed by two bones. Is that right? And these two bones articulate with each other to form that particular joint. And so let's say, for instance, this is the humeral head and this is the glenoid fossa. We know the humeral head articulates with the glenoid fossa to form the glenohumeral joint. That is the shoulder joint, as we may say. So each of these bones have imaginary points on their surfaces. So we assume that there are some points here and there are some points here. When we say rolling, rolling simply means that series of points on an articular surface comes into contact with a series of points on another articular surface. So in this case, we have a series of points on the articular surface of this humeral head coming into contact with the articular surface of this glenoid fossa. If you are practicing how rolling will be, then it is going to be like this, rolling, so we can see that if we have a point here, this point will contact every point that is here before the rolling ends. So if you are starting, it will start from here. You understand? Yes, that's how rolling is. Now let's move on to distraction. So when we say distraction, what does it mean? Distraction of a joint means we are pulling apart the joint. So we stabilize one of the bones and then we pull the other one. So for instance, this is the glenohumeral joint. If you want to distract, then it means we are going to stabilize the glenoid fossa and then we pull apart the humeral head, isn't it? Yes. But what you have to note is that pulling apart of something can also mean traction. But the only difference between traction and distraction is that with distraction, we pull apart so that the part that is moved forms a perpendicular angle with the treatment plane. So this is the glenoid fossa and this is the humeral head. We stabilize the glenoid fossa and then we pull apart the humeral head perpendicularly to the treatment plane. So with respect to traction, traction can be done in any other angle apart from 90 degrees. So I can choose to pull apart this way. You see, this way doesn't form 90-degree angle with the treatment plane, isn't it? So it will not be distraction, but it will rather be traction. But distraction will form 90-degree angle with the treatment plane. So have that in mind.